It is 6 a.m. and right now on Denver7 News, a new layer of COVID restrictions across Colorado.
We in Colorado need to act to stop this exponential growth.
Among them, no more eating inside restaurants in 15 counties.
We made it through the last closure. We're hoping to do the same this time.
State leaders are pleading with Coloradans to follow the rules. I'll walk you through the ways your life could be changing in the next few weeks.
Plus, a dream job for an avid traveler.
He was so excited and talked about it all the time.
A TSA agent at DIA loses his battle with COVID-19.
He was trying to go to the hospital, but it was too late.
With Thanksgiving a week away, his family wants you to think of the workers before getting on a plane.
I don't think it's safe for anyone to travel.
And that is hard to hear as we face tough decisions for the holidays. That goes for families and businesses. Good Wednesday morning to you. I'm Brian Sanders.
And I'm Molly Hendrickson. Thanks for joining us this morning. We start with meteorologist Lisa Hidalgo at her home weather center. Lisa, one more warm day before a cool down moves into the Front Range.
Yeah, tomorrow will be a little cooler. It's going to get quite a bit cooler, though, by Friday, and we'll take a look at that coming up. A pretty start to our day. It looks like we're in for another gorgeous sunrise with just a little bit of cloud cover across the eastern plains this morning. You can see it streaming in from the west and northwest. The winds now coming in from the south and southwest, starting to pick up, and because of that, fire danger is going to be higher. We do have red flag warnings going into effect by midday, covering parts of Douglas County and then south and east from there. The winds will pick up, and obviously it's going to be really warm and dry. Take a look at the warm up. We're in the 50s right now. We're likely going to be in the low to mid 70s between 2 and 3, and then we'll cool down after sunset. But you've got a really warm day today, well above normal. In fact, much closer to the record high of 78. Yesterday, Jason, we tied the record high. We're going to get pretty close to it today with highs right around 73 to near 75.
Not a bad way to live through November, I'll tell you that. We have a good drive for most of us around town. We are open on Highway 6 going west from Golden all the way up to 119. That actually opened early, but there's another scheduled closure tonight. The one big traffic jam of the morning is going to be from a crash on that eastbound side of 270 transitioning to I-70. Mainline I-70 is okay, and as you take a look from the camera there, this is I-70 heading east, and this is the drive on westbound, but it's right up here. This is the bridge, and you see those headlights? Those are some of the trucks and the cars that are going on that ramp, and they're going very slowly. Unfortunately, it is a big, long traffic jam across Commerce City right now that starts before Vasquez, but a half an hour here, so I would suggest I-25, I-70, run that way, save you a whole bunch of time and all that aggravation of sitting in that traffic jam.
Thanks, Jason. There is now an updated COVID-19 state dial to determine what new restrictions should go into place across Colorado. This purple level was just added by state leaders yesterday. It is for extreme risk of COVID-19 exposure. Starting Friday, these 15 counties will be under level red. That was previously the level where a stay-at-home order would go into effect. Every county in the metro will be in the red come Friday.
Governor Polis says the new guidance and new restrictions that come with it, though, will help reverse the accelerating growth of COVID-19 transmission.
We're getting there. We just need to get through these difficult few weeks to make sure that we can break this exponential growth curve.
So Denver7's Nicole Brady joins us live this morning. And Nicole, the new red level mostly impacts restaurants and small businesses already hit hard.
They've been hurting so much already, and really for the restaurants, Brian, it's almost back to the way it was in March and April. Absolutely no indoor dining allowed with these new restrictions. You can still do outdoor dining, so we've seen some heat lamps being set up outside in some patio areas, and you can still do takeout and delivery to support these restaurants. But it's not just restaurants that are affected here. Gyms are being reduced to 10% capacity, so you might have to find another place to exercise just at home or outside. Also, non-essential offices are being encouraged to go fully remote. Non-essential retail and even some critical retail like grocery stores are reducing capacity, so I wouldn't be surprised to see some lines when you're shopping. And then the big one, really, with just 8 days till Thanksgiving, no private gatherings at all outside your own household. The governor and Denver's mayor pleading with Coloradans yesterday to follow these rules.
And I'm calling on Denver and the metro region to step up like we've done before, to push back mightily on this virus and get back under control. The blunt force response of another stay-at-home order can be avoided.
That's what we don't want, a full stay at home. But the governor said it comes down to doing three things: wear a mask, socially distance, and no social interactions outside your own household. That's what they say is necessary to avoid moving into that purple zone and another full shutdown. Back to you.
Yeah, as bad as it is with the red zone, it could be worse. Thank you, Nicole. If counties make it into that purple or extreme risk zone, essentially all restaurants, businesses, and gyms would close. Indoor and outdoor dining would stop, meaning restaurants can only do takeout. Personal gatherings would end. Gyms would have to be outdoor or virtual classes only, and there would be limited capacity at offices and places of worship. But again, we are not there yet.
The state legislature's special session for COVID-19 relief likely won't happen until after Thanksgiving. Colorado has about $200 million in unexpected additional revenue from income tax. The governor says the special session will focus on four things: a small business relief package and tax relief, housing and rental assistance, support for child care providers to help them stay open so families can work, and expanding broadband access for students and educators. Lawmakers say they are ready to help.
Here's an opportunity for us to do something, and I think if we didn't do anything, it'd be unacceptable for Coloradans.
Some Republicans say they are glad the governor has called this special session. Others, like Representative Patrick Neville, questions the timing and safety of a special session. Meanwhile, Colorado Congressman Ed Perlmutter tested positive for coronavirus. He says he is asymptomatic and feeling good. Perlmutter is currently in Washington, D.C., isolating in his apartment. He says he will still work and vote remotely.
Hospitals are developing plans on how to handle a surge in coronavirus patients, and those plans must be submitted into the state by today. Denver7's Micah Smith joins us live this morning. And Micah, these plans have to address two main concerns.
They do, Brian. The surge plans that hospitals have to have in place must address maximizing ICU beds. But after speaking with a local healthcare system, I'm also learning that hospitals here in the Denver metro are worried about another big shortage, and that's staffing. Governor Polis's executive order requires hospitals to submit plans to the state that include the maximum surge bed count by today. They also want that plan to include how to transition medical and surgical beds to ICU if needed. And the state wants a detailed staffing plan on how to provide adequate care for everyone. But after talking with the chief medical officer for Denver Health, Dr. Connie Savor-Price, staffing is still a big concern. They do have a plan in place, but she worries about staff members that are just burned out. She told me so many nurses have been working nonstop since March and have even been called in on their days off.
Now our focus is preserving our staff who are tired, who have been working hard since the spring. They want to take vacations, and some of them, with the high rates in the community, also get sick.
Some states like North Dakota have required nurses that test positive for COVID-19 to work if they are asymptomatic. Dr. Price says we aren't there yet, and she feels good about how her staff has responded to the situation, and she feels good about the quality of care that patients are receiving. But she's pleading with everyone to help her staff out by wearing a mask and social distancing. Reporting live, Micah Smith, Denver7.
They are working so hard for us, it's the least we can do. New this morning, Pfizer says its coronavirus vaccine trials are done, and the vaccine is 95% effective. The results show the vaccine prevented mild and severe forms of COVID and does not have any serious side effects. Pfizer representatives say they plan to apply to the FDA for emergency authorization in the coming days. The White House Coronavirus Task Force ramped up a warning to states in its weekly set of reports obtained by CNN. The group said the current mitigation efforts are inadequate and must be increased to flatten the curve. The COVID Tracking Project reports more than 77,000 Americans are currently in the hospital with COVID-19.
Dr. Anthony Fauci says we need to have a unified approach to defeat the coronavirus. In an interview with the New York Times, Dr. Fauci says leaving decisions up to individual states causes confusion.
We need some fundamental public health measures that everyone should be adhering to, not a disjointed, one state says one thing, the other state says another thing.
Fauci also said we should forego holiday plans if we can. Testing sites and hospitals across the country are overwhelmed.